Welcome to today's Explainer. So, today we're going to put on our medical detective hats to uncover the true mechanisms beneath a condition that is, honestly, so widely recognized, but totally misunderstood. If you've ever seen those characteristic red patches and silvery scales, maybe on someone's elbows or knees, you've seen psoriasis. But what you're actually looking at, that's just the tip of the iceberg. I'm going to take you on a little journey today, straight through the skin, down to the cellular level, and into the immune system itself to decode the massive misfire that's happening right beneath the surface. Okay, so let's just take a quick look at our roadmap. We're going to start at the surface with more than skin deep, then zoom way into the cellular level with the immune misfire and skin cells on fast forward, and finally zoom way out to see the whole body impact and how we target the root cause. Let's kick things off with Section 1, More Than Skin Deep, Shattering the Myth. Now, before we get into all the heavy science and the cellular pathways, we have to clear up a massive misconception. We literally need to shatter a myth that frankly causes a ton of unnecessary suffering for the 125 million people globally living with this disease. I want to ask you directly, is psoriasis just a cosmetic issue? Or, maybe just really dry skin? When you see a skin plaque, it's just human nature to assume it's a localized problem, right? Like a rash that just needs a good moisturizer. But that assumption, it couldn't be further from the truth. Here is the actual medical reality. Psoriasis is a chronic, immune-mediated inflammatory systemic disease characterized by accelerated cell growth. I really want to emphasize that word, systemic. This isn't just a skin disease, guys. It is an internal, whole-body disease that simply manifests on the outside. Your skin is essentially acting like a warning light on a car's dashboard for a raging inflammatory fire happening inside the engine. And because it's systemic, the hidden burden here is just massive. Studies consistently show that the quality of life impairment in psoriasis is comparable to things like heart disease, cancer, or diabetes. Just think about that for a second. The physical exhaustion, the intense itch-scratch cycle that ruins your sleep every single night, and the crushing social stigma of having visible lesions. Patients so often isolate themselves. They avoid swimming, going to the gym, or intimacy, all out of this intense fear of judgment. The psychological toll goes so far beyond what the eye can see. Moving on to Section 2, the immune system misfire. So let's transition down to the microscopic level. What is actually going wrong inside the body to cause all of this? Well, when we look at the root cause, it's fascinating how heavily the deck is stacked by genetics. The heritability of psoriasis is estimated at a massive 60 to 90%. So while environmental triggers definitely matter, your DNA is what loads the gun. Specifically, there's this genetic locus known as PSORS1 within the HLA region, and it's the real heavy hitter here. If you have this specific genetic architecture, your immune system is basically primed, just sitting there waiting for a reason to overreact. And here's exactly how that overreaction plays out. Let's walk through this pathway step by step, because this is really the core of the disease. Step 1. An external trigger, say an infection or even just a scrape on the skin, activates your innate immune cells, particularly dendritic cells. Step 2. These activated cells release a signaling protein called interleukin-23, or IL-23. Step 3. This IL-23 signal acts like a drill sergeant, commanding naive T cells to morph into specialized, super-aggressive T17 cells. And finally, Step 4. These T17 cells pump out massive amounts of IL-17A. Basically, this IL-23 and IL-17 axis is an overzealous alarm system. It tricks your body into a state of chronic emergency, totally flooding the system with inflammatory cytokines. All right, Section 3, skin cells on, fast forward. Now that we've mapped out that internal immune misfire, that huge flood of IL-17A, we need to connect it to the physical symptoms we actually see on the surface. What does that chemical alarm bell do to your skin cells? Well, it turns them into a factory assembly line stuck on fast forward. A normal skin cycle replaces itself approximately every 28 days. The skin cells, called keratinocytes, have plenty of time to mature, completely differentiate, and smoothly shed off. But in a psoriatic skin cycle, which is bathed in that inflammatory IL-17A, the cells are literally forced to multiply rapidly. And because they're rushing, they just don't finish maturing. They experience incomplete differentiation and actually retain their nuclei. They're essentially unfinished products just getting shoved out the factory door. And the sheer speed of that broken factory line is staggering. We go from a turnover cycle of nearly a month, dropping all the way down to just 3 to 5 days. No way, right? Just a few days? So because these cells are rushing to the surface so incredibly fast, they can't shed properly. They just pile up. Those characteristic thick red plaques and silvery white micaceous scales you see in psoriasis, they are actually densely packed, incompletely differentiated keratinocytes. The redness you see comes from dilated blood vessels rushing underneath to feed this frantic cellular factory, and the white scale is literally just millions of unfinished skin cells stacked right on top of each other. Which brings us to Section 4, Triggers and Systemic Ripples. Let's zoom way out from the microscopic level for a minute. If your immune system is this agitated, what actually sets it off? The relapsing remitting course of this disease is heavily influenced by systemic and behavioral triggers. Strep throat is a classic one, especially in younger patients. Alcohol, smoking, and obesity are huge independent risk factors, mostly because adipose, or fat tissue, itself produces inflammatory cytokines. There's also this fascinating thing called the Koebner phenomenon, where physical trauma, like a scratch or even a new tattoo, triggers a brand new plaque right at the injury site. But definitely notice psychological stress on this list. It is an incredibly cruel bidirectional relationship. Stress activates your sympathetic nervous system, which worsens the disease. And as we just talked about, having the disease causes immense psychological stress. It's a vicious loop. So the crucial takeaway here is that when your immune system is dumping all those inflammatory cytokines like IL-17 and TNF-alpha into your bloodstream, it doesn't just stay in the skin. Obviously, it circulates and damages other organs. To put that into perspective, patients with severe psoriasis have a 50% increased risk of major cardiovascular events. Psoriatic arthritis develops in up to 30% of patients, absolutely destroying joints. The risk for Crohn's disease in the gut is 2 to 3 times higher, and there's a 40% higher prevalence of metabolic syndrome. The exact same inflammatory fire that's burning the skin is burning the heart, the joints, and the gut. But don't worry, Section 5 is all about targeting the root cause with precision medicine. After all that heavy reality, I do have some incredibly hopeful news. Welcome to the biologic revolution. Modern science has used everything we just explored, all those super specific cellular mechanisms, to totally revolutionize how we stop this disease. We no longer just have to treat the skin with messy topical creams that only mask the symptoms. Instead, we use targeted biologics, kind of like snipers. We can actually inject antibodies that hunt down and neutralize the exact cytokines causing the alarm. We have TNF-alpha inhibitors. We have IL-23 inhibitors that block that drill sergeant from ever even giving the order. And we have IL-17A inhibitors that basically mop up the specific cytokine causing the skin cells to go on fast forward. By shutting down these specific inflammatory pathways, complete skin clearance isn't just a dream anymore. It's an achievable goal for so many people. However, precision medicine only works if you have precise diagnostics. Psoriasis is actually incredibly commonly misdiagnosed as atopic dermatitis or eczema, and this is really dangerous. As we know, psoriasis is driven by the IL-23 and IL-17 pathway, and it typically pops up on the outsides of elbows and knees with really sharp borders. But atopic dermatitis, that's driven by a totally different pathway, IL-4 and IL-13, and usually appears in the flexual folds of the skin with poorly defined borders. Treating the wrong immune pathway with these biologics can actually make the other condition worse. You absolutely have to match the drug to the correct immune misfire. And that brings us to our core takeaway today. Understanding the mechanism doesn't just clear the skin, it heals the whole body. When we correctly diagnose psoriasis and use these amazing targeted therapies to quiet that internal IL-17 alarm system, we aren't just making the skin look better. We are actively lowering cardiovascular risks. We're protecting the joints from irreversible damage. We're reducing the risk of metabolic syndrome. We are restoring a patient's sleep, their confidence, and quite literally giving them their life back. It is just so fascinating how interconnected our biology truly is, isn't it? It really makes you wonder, if our skin is a window to our internal health, acting as this early warning system for profound immune and cardiovascular issues, what other systemic secrets are hiding in plain sight, just waiting for us to decode them? Keep that in mind the next time you look in the mirror. Thank you so much for joining me on this explainer. Keep learning, keep asking questions, and I'll catch you next time.